And so you just know, oh, okay, developmentally, if you are exposed to phenylalanine, then you can have the cerebral or the higher sort of cognitive issues especially. And so you just reduce phenylalanine in the diet, and then you can kind of control the toxic side effects of phenylalanine. And so that's why that warning is on the aspartame sweetener. So that's an example, 1 in 25,000 births, and we test all newborns in the United States. Sickle cell anemia, oh my gosh, we could talk about this forever. Won't, because it's noon and I'm getting done. What number of slide is this? Can you tell? 50? 52? 50. Crap. Okay, we're getting there. Bear with me. I might give you too much longer. Sickle cell anemia, another autosomal recessive trait, but there is incomplete dominance. So here's a cute example. It's not cute if you have it, but I mean a cute example where we can see incomplete dominance, where there's that blend, in a sense, where that dominant doesn't completely mask it, but you have some sort of blend of trait. So like you had the red flower and the white flower and the pink flower was in between, the heterozygous, that's incomplete dominance. And here's sort of an example. So heterozygotes, or carriers of sickle cell anemia, so this person, these people right here, which would be half of 50% chance that any child from heterozygote trait carrying sickle cell parents, 50% of their offspring should be carriers. So that heterozygote is considered a carrier. Single nucleotide defect, one nucleotide. You probably, if you studied this, they tell you exactly which one, and I don't remember because I don't really care. It doesn't matter which one it is. But from my standpoint, I mean, but the single nucleotide, and you end up with this whole disease state. But what happens is that hemoglobin generally is just floating, it's soluble within that red blood cell, carries oxygen. In a deoxygenated or low oxygen tension point, which happens to all of our red blood cells and capillaries, because we've exchanged the oxygen, left the oxygen off for tissue because the mitochondria need it, because they're making ATP. That in that case, a low oxygen tension, those hemoglobin molecules don't stay soluble. They tend to polymerize and form chains, such that they're actually fibrous and will deform the shape of the entire red blood cell, where it will appear sickled. And you can see them in that picture. That is really, it's impressive how sickled that one cell is. Then those don't slip and slide like they're supposed to, because in capillaries, red blood cells march along like single file soldiers, and they clog. And so on the other end of that, where things have, those sickles have created clogging, and you have lack of perfusion to tissue beyond the site of polymerization. So it's something that can happen, especially at any low oxygen tension, but also exercise and whatever. So if somebody has sickle cell anemia, full-on, lower autosomal recessive, they're very, very devastating disease. Chronically, they can have anemia, lots of infections. There can be dactylis, is what that's supposed to say, dactylitis, especially where there are really clogging at small little pieces of tissue perfusion, so you can really see painful digits, pain in the digits from that. Vaso-occlusive pain, tissue injury, spleen damage. The spleen is trying to clean all this up, red blood cells up. Pulmonary hypertension, delayed blood growth chronically, and then acutely there are sickle cell crises where the person will go into a stroke or acute chest syndrome or some kind of myocardial infarction and stuff like that, and tremendous pain during crises. That's the disease. What if you are the heterozygous, then you're carrying the trait, and that is the heterozygote. About 40% of their hemoglobin will become sickle, and that HB means hemoglobin, and the S would stand for the sickle trait in the hemoglobin. So it means that the majority, it's an incomplete dominance, there's something sort of in between. The majority of the hemoglobin stays soluble, but about 40% of it is able to sickle now, or to polymerize. That shouldn't necessarily cause that whole cell to sickle. You won't necessarily get that occlusion in the capillary beds that you get with sickle cell anemia as a trait. But it did confer, what it does confer, and you've probably heard this in whatever class you studied this, but it incurs a resistance to malaria. And so it may be, it's not a completely deleterious thing. Like our allergies are not a deleterious, I don't want to compare them, but our allergies are not necessarily deleterious, but if they ramp against your tissue, then it can cause tissue damage. And so we see a negative when it's trying to protect us. And so malaria infects red blood cells. And so this was just protective against malaria, and probably kind of, it developed with a positive cause for that reason. We see it. But 2.5 million people in the U.S. have the sickle cell trait. And there's necessarily symptomology that goes with that. Cystic fibrosis and autosomal recessive, again, 1 in 3,500 births. There's more than one flavor of which mutation you get in cystic fibrosis, but overall, it's a channel protein in sweat glands, and that it changes, the mucus isn't quite the same. Secretions aren't quite the same, they're thicker. And so one of the first places we see that as a problem is in the respiratory system, very thick mucus. So kids with cystic fibrosis have a really difficult time clearing secretions. Also, the pancreatic secretions are changed as well. So the life expectancy, you know, a cystic fibrosis person would go on to adulthood, but not necessarily past that. There's changes in new medicines and always something developing there. But it's an example of genetic disease where there's just a protein that is in error. There's so many of these, but here's an example, another example, polycystic kidney disease. Look at those post-mortem kidneys. They have many cysts, polycystic. And there are two forms. One is an autosomal dominant example, and that's why I put AD there. Another is an autosomal recessive. So there's two different forms of polycystic kidney disease. And there are these autosomal dominant, I think Huntington's is another example, these autosomal dominant where any dominant allele gets the disease. So most people in society are recessive for that gene, or have the normal gene. It's a mutation on every nephron cell, and what it does ends up with is causing these cysts in the kidneys, which then can end up with high blood pressure, so that the disease doesn't show up until a person is 40 to 60 years of age. And their kidneys look messy like that. So a lot of your renal, a few of your renal failure patients will be PCKD. So you'll hear that. That's just a genetic disease. Hemophilia, really common, excellent recessive trait. So in those, because it's X-linked, it tends to show up in boys more because they don't have two alleles to choose from. They only get one X, so they only get one allele. If they get the deleterious, the mutated one, then they've got the illness. And there's several forms of hemophilia. X-linked recessive is factor 8, that's the most common, and this is just really in the clotting cascade. Something happens, and that makes something else happen, and something else happens, and then platelets aggregate, fibrin will form and try to seal up leaks in the blood vessels. It's a good thing. Coagulation is a good thing. When you can't coagulate, then you can bleed, and that's what these are. So factor A or factor B, and they're both X-linked recessive. I put XR there. One in 27,000, one in 7,000. Impaired clotting cascade, frequent bleeding, bruising. Hemarthrosis is bleeding into the joints. That's painful. Internal bleeding, intracranial hemorrhage, bleed in the brain. Decreases lifespan by 10 years, so that's not a ton. Lifespan for a U.S. male here in the U.S. is 76. We're not leading the pack on lifespan, by the way. And so that should be about 66. So, you know, just looking at it that way. Neurofibromatosis, just another example of genetic disease. Defect is just in a single protein, neurofibromin. It's a tumor suppressor. So when the suppressor is defective, the tumors can grow. There are 3 forms of it. Neurofibromatosis 1, 2, and 3. And where the tumors form is where those different flavors. But you see these cafe-au-lait spots, which are not necessarily related to just neurofibromatosis. Lots of people have them. But we begin to say it's a possible diagnosis when there are more than 6 of them. So this melanin deposition is associated with it. And then there are tumors under the skin, skeletal deformities. Who's the guy, I've lost his name, the Elephant Man, that was that person who kind of sold his story so that he could make a living and live, that had the, what's his name? I left it, it's left me. But anyway, England in the 1800s, and that's his skeleton. So they preserve that. I don't know who owns that right now. I looked that up, I forgot. But here's a picture of a guy, he's holding a picture of himself before the tumors arose, and not necessarily inconsistent with life, but you can imagine how difficult it is to carry all of that skin and such around. And then our last slide, congenital disorders. So I just wanted to tell you, you hear birth defect a lot. And a birth defect just means any disease state or deformity that's present at birth. It does not go on to say why it got there. So 3% of all births show birth defects, so from any cause. And the most common defects are congenital heart defects, and so you learn a lot about that. And I guess in pediatrics probably is where you learn that. You know, the septal, what's the word? The septal defects, or the holes where the heart is not, the septum is not patent. Those are very common heart malformities. And neural tube defects, where the neural tube doesn't completely close. Spina bifida is an example. Those are the most common, but it doesn't necessarily mean genetic or chromosomal. It could be from exposure to something at birth, or just a one-off developmental disorder during embryogenesis. So that's a big range of names. So when you hear birth defect, it doesn't clue you into the cause. And then teratogenesis is finally a study of what are the chemicals that we're exposed to that can cause defects that are dangerous in utero. And so, you know, that's a whole thing. But teratogenesis is the creation of carcinogenic agents, basically. Is that my last one? Oh, no. Oh, okay. I don't really know why that's there. I didn't even notice this when I was going through it. But it is the principles of teratology, how they apply. I'm not going to ask you stuff about this, but I put it here because it's one of the, how do they then define what is teratogenic and apply that to certain chemicals. And this is where we like Big Brother to be watching us, right? We like that we pay into a government that does try to keep us safe by looking at things. We also get very angry that they don't, good drugs are not, things that are working, get through fast enough and stuff like that. But, you have to be very careful what you're going to expose the community to, the population to. So anyway, and that's Spencer Thomas. That's my beloved black lab, and he's no longer with us. but this is the end of this. He's there to say it's, but go home, that's what I'm trying to say. Thank you very much. I'm submitting 7 questions. I'm not asking you a ton about the diseases. I don't think that's what it is here. But you should know what it is. Is it chromosomal abnormality? What is the abnormality there that's associated with that? And then just some basic stuff about all of this. I do look at my email, and it's rpaulk@okcu.edu, I guess, that would be the right one. And so email me if you have questions. Please rest yourself. It's a nice day. Give yourself time to enjoy it. Nurture yourself every day. Study a lot.